Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, Governor Corbett gets inaugurated on Tuesday, and health care once again looms as an important issue. And then Congressman Todd Platts will weigh in on the horrific Tucson shooting, all that and more. Pennsylvania politics and government, in depth and in detail, and guess what? It all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, joining me, as often is the case, is Carolyn Scanlan. She's the president and CEO of the Hospital and Healthsystem Association of Pennsylvania. When we have these complicated health care issues, we bring Carolyn in. She's one of the real experts in the state. I want to talk, Carolyn, a little bit about a program known as Adult Basic. It's very important. There's some 45,000 people who qualify for the program. It is scheduled to end in June, and there's been some new and important developments. First of all, what is Adult Basic? What is the insurance program?
It's a program for individuals who had income that was too high for them to make them eligible for Medicaid, but an income not high enough for them to be able to afford health insurance. It's like a lot of people in the state and the country who don't have health insurance. And in 2001, this state was part of a multi-state settlement with the tobacco companies. Our Attorney General at the time was Tom Corbett. And the state received a settlement of $11.3 billion.
Right.
The Ridge administration wanted to develop a legacy use of that fund, and through an allocation, 30% of an annual $400 million of that was to be used for the creation of a health insurance program,
this program
now known as Adult Basic. Over the course of the program, dollars have been moved around, and 6 years ago, the Blue Cross plans in this state, through something called the Community Health Reinvestment Fund, actually began putting additional dollars into the fund, and over time, the tobacco settlement dollars were decreased down to $10 million this current fiscal year.
Okay, so let me get this straight. Adult Basic is set up in 2001. It's this sort of Medigap coverage. People who can't qualify for Medicaid can buy this coverage. It's supplemented the cost of it by tobacco settlement. Now more the Blue Cross carriers are putting money into coverage, scheduled to end in June. Now, there's some controversy over their notification when they get. We're not going to get into that controversy, but it's scheduled to end, and the incoming Corbett administration took the bull by the horns, so to speak, and said, we got to deal with this. And what are they proposing to do?
As I understand it, all 4 Blue Cross plans have a program that they call Special Care. It's supplemented in cost by the Blue Cross plans themselves, and quite frankly by hospitals who get paid a little less for taking care of these individuals because we participate in this program. And that Special Care program is going to be offered to all 40-some thousand individuals who are on Adult Basic.
It won't be expanded.
It'll be more expensive for them, but not as expensive if they went to
go buy
private insurance. And what's most important, most of the people who are on Adult Basic are there because they have a health problem, a pre-existing condition. That a barrier for buying it will be waived. So even with a pre-existing condition, they'll be able to buy special care.
Your judgment would be that the Corbett administration is doing the right thing here.
It sure appears to be that. Now, it will be more expensive for these individuals.
But there will be no coverage otherwise, and given the fiscal situation of the state, the fact that they're moving as quickly, All right, we're going to run to a break. When we come back, I want to get into 2 other things before we let you go. All right, we'll be back. We're going to pay some bills talking about money. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back. Well, we're talking health care with Carolyn Scanlan and then Congressman Todd Platts on the horrific shooting in Tucson. When I asked the congressman about what he thinks Congress is likely to do, he'll be on in a few minutes. All right, Carolyn, let's talk about, look, the state is scheduled to lose 20% of the budget goes to sort of welfare health care costs. Medicaid leads the way here. State's scheduled to lose $2 billion, change the formula. You'll get into that. We don't need to get into that in detail, but it's a huge problem for the state. What's going to happen? What's the solution?
Well, from a hospital point of view, hospitals are a pretty important part of the delivery of health care to the Medicaid patients.
Right.
And we are a pretty important economic driver in all the communities. And so we've reached out to the transition teams and to the governor, indicating that hospitals need to be kept vibrant. We want to be part of a solution. In fact, last year we developed, and it just got approved at the end of 2010 by the federal government, a new way of paying hospitals for Medicaid care. And as part of that, we maximize some new federal dollars, some of which go in to help the state budget.
Now, must the state match those dollars?
Yes, the state has to spend money to get that
See, that's
federal
the point
match.
I'm getting at now. With the loss in money and the potential cuts, that represents a serious challenge to the entire health care system in the state, correct?
It does for everything we do in Medicaid, because everything that the federal government pays for is generally a match for something else that the state is spending. And so for every dollar that the state would cut, you lose $1.40 from federal money. So I think we're going to have to weigh that pretty carefully and talk with the new administration and the legislature about it.
But you would say that, I mean, this is one of the 2 or 3 most significant challenges. There's a ton of them, I guess, facing the new government. However it gets resolved, I mean, there's no doubt this is one of the more serious challenges that the administration has to deal with, correct?
It is. But what I would hope that they do when they look at the budget is not look at each piece of the budget as a standalone silo.
Yeah.
When the budget gets put together and when the state got additional federal money as part of the stimulus, that money didn't go to hospitals. We didn't get additional money. That money was used for other programs in the rest of the state.
And at the moment, you're still getting lots of people who are walking into your doors. I mean,
totally
you're treating
uninsured.
them uninsured, and that's obviously not helpful to the balance sheets of your hospitals, correct?
It isn't for that, and it also isn't helpful for the rest of us who buy insurance, because some of those costs get spread into all of our costs.
All right, I want to talk, there's some other things that I think you and other healthcare organizations think need to be done. We'll have you back to talk about that. Before I let you go, I want to talk about one more thing, and that's sort of aspect of tort reform that you've not been able to get over the goal line, and that's called the Fair Share Act. At the moment, if there's a case involving liability, and there may be 4 or 5 folks involved, you know where I'm heading. You explain that to people, why they should care about it.
What they should care about is that that individual or that company that is liable should pay their share.
Right.
And if an organization is only 10% liable, they should pay 10%. But when everybody involved gets sued and 4 out of the 5 can't pay, that entity that's only 10% liable may end up paying 100% of the liability.
Now, Governor Rendell vetoed a bill that would have accomplished that in his, during his administration. Governor-elect Corbett has said he would sign that bill. Is that correct?
He has, and the House Majority Leader, Terzai, has indicated that they want to move that bill fairly quickly.
But it's still going to be a tough fight in the legislature from what I can gather,
It's always a difficult conversation to have around liability issues.
Okay.
But, when you have 2 out of the 3 parties indicating, at least publicly, that they want to move it, we think that's good. And it did pass the Senate and the House. Several years ago. It actually passed twice. It also passed under Governor Schweiker.
All right, there you have it. Thanks. Congressman Todd Platts from the 19th Congressional District, he'll be up next. We're going to talk about that horrific shooting in Tucson and what Congress may or may not do. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, joining me is Representative Congressman Todd Platts. He represents the 19th Congressional District. That would be York, all of Adams, and parts of Cumberland. You impressed that I got that down, Congressman?
You got it. Great to be with you, Terry.
All right, look, turning to a serious matter, obviously this horrific events in Tucson has, and tell me if I'm wrong, has shaken Congress to the core.
Absolutely. You know, when you have one of your own, a colleague that we all know and is loved by everybody, both sides of the aisle, to be targeted and attacked in such a vicious manner, and to have 6 innocent individuals killed, about 14 others badly injured, it was horrifying for everybody, the nation as a whole, especially the loss of a 9-year-old little girl.
Yeah. And you were on a committee with Congress.
Served on the House Armed Services Committee with her, and just recently met her husband Mark, and just a wonderful couple, a service-oriented couple, and he's a Navy captain now.
You know what was sort of remarkable to me was, as you know, I'd never met her, but sort of the outpouring from both sides. It seems as though she was universally liked.
Absolutely.
Even if, you know, and she was a blue dog Democrat, and, you know, had voted for some of the stuff that the president did, but she was wanted the borders secure, and we're learning more, particularly those of us here in Pennsylvania might not have followed her career.
Yeah.
But is that true? I mean,
Absolutely.
is that genuine what people are saying about her?
It is. You know, Gabby is just a nice person, a great colleague who was about issues. And if you look at her positions, you know, strong Second Amendment defender, voted for the health care, was trying to crack down on border security. You know, she was someone who was just interested in doing a good job for her hometown, where she grew up, and you know, we're keeping her and everybody in our prayers.
Yeah, well, we all are. Great sentiment. All right, let's talk a little bit about what Congress might do now. Congress can act, it can react, and it can overact. Overreact. I think we all know that. But let's sort of talk about some of the things. Number one, there'll be a proposal to make an attempt to assassinate members of Congress a federal crime. It's not a federal crime. It's a federal crime to attempt to assassinate the president. So if someone, God forbid it would never happen, will go after you or one of your colleagues, they would be prosecuted in state courts, presumably. Now it would make a difference. Is this a good idea or a bad idea?
Well, you know, making it clear that it's wrong to go after anybody and a public official.
Sure.
But the reality is, we could have had that law on the books a week ago, and it wouldn't have made a difference. The issue here wasn't that there were not laws against this. There clearly are. But it was an issue of a mentally disabled, mentally deranged individual who took the lives of 6 innocent people and injured others. So, you know, we can look at legal, law changes or amendments and improvements.
You think that would be more symbolic to say, if you do this, you're going to get the feds on your case?
I think so, because I don't think, again, that would have prevented this individual. And
well,
I think,
right about
it's important that we not, and you said overreact, or allow the actions of a deranged individual to change the way Congress operates, and especially the way we engage our citizens. And one of the things about this event...
I think that's important, by the way. I think you're on to something that's very important.
This Gabby Giffords was out doing one of the most essential duties of an elected official, reaching out to her constituents. And that is key to us being representatives. And I'm one of the lucky few. I live in my district every day. And so I get feedback in town hall meetings. I get feedback at public events. I get feedback at the checkout line at Giant.
Sometimes good and sometimes bad, right?
Actually, it's always interesting, but it's always good. the more feedback
no,
I
you
get,
know what I mean. Sometimes they're screaming at you, and sometimes they're saying, "Good job, Congressman."
Well, and that goes with the
sure
the territory. But the key here is it wasn't just Gabby Giffords and the others who were attacked. It was one of the cornerstones of our form of democracy. Elected officials engaging their constituents, and we must. It's imperative that we not allow this attack to prevent that from happening.
The last thing you would want, I would think, is a wall between you and your constituents, and that's why
can't happen.
Yeah, we're going to run to a break. When we come back, I want to ask you about whether you feel you should have armed, security details. Obviously, the president does, the vice president, and there are other officials that have them. You currently, once you're out of the Capitol, you're on your own, correct?
Right.
In the Capitol, there's security that protects you. Once you're gone, you're out on your own, right?
Unless there's a known threat, some raised concern, and then you have additional security.
All right, we're talking with Congressman Todd Platts about sort of the reaction that may or may not occur in Congress. We know that very emotional week from members of Congress, as reported in virtually all the media. We'll continue our conversation with a congressman following these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to the program. We're talking with Congressman Todd Platts about the horrific shooting and the reaction in Congress as it continues to be, I think, dominate the news, and rightfully so. Congressman, we were talking a moment ago about the security details. What would be your general attitude towards saying, okay, Congressman, you're going to have two people following you, whatever it is, 24/7 security? Is that a good idea or a bad idea?
I think it's a bad idea. One, I think it's unrealistic, and I don't think it's necessary in the norm, because it's important to remember that this attack is a rarity against elected officials, members of Congress, and we don't want to overreact. And the more we put security with members,
right,
the more we will isolate members from the public. And if you look at what is behind this, and we're going to learn more as the days and weeks go on, the individual who attacked our colleague and the other citizens is clearly somebody with a severe mental illness.
Yeah.
And part of what we need to be looking at is how do we better identify and treat those with mental illness. I think that would be more productive than trying to isolate us.
You've raised a great point. I mean, I think there are two things that are being debated right now. One is, how are we dealing with mental illness? Not so much how are we treating it, but how are we identifying it and getting people into treatment who need it. And then the other area is gun control. Let's talk about the mental. This is a tough thing. I mean, how do you decide, and when do you decide that someone is a danger, and whether they should be able to purchase a weapon?
Yeah.
We haven't figured that out yet, have we?
Well, as far as infringing on a Second Amendment right, there needs to be a process, a due process engaged in, and we are doing better once somebody's in the mental health system and identified as having mental illness. Then there's a way to have them be prohibited from then purchasing a weapon. This individual clearly had mental health issues,
there's no doubt
but
about
was
it.
not within the system being treated, and therefore still was able to go and purchase a weapon and commit this horrific attack.
Yeah, because he was not in, quote, in the system, as I understand. You correct me if I'm wrong. He was not in the system, and then the other thing that sort of struck me was that, he had been dismissed from the community college, Pima Community College, and the college rightfully said, well, you're not getting back in unless you have some evaluation, but after they dismissed him,
they kind of washed their hands of
and then he's sort of free-floating out there, and the more and more we learn. But a lot of people have mental illnesses who aren't going to pick up a weapon and go after you, you or anyone else.
Yeah. And that comes back to why, I mean, in my time in office in the State House and Congress, I've had threats, the most serious of which were related to somebody with mental illness who was off of their prescribed medications, and law enforcement got involved and saw that the person
Did that worry you
so.
when you went to additional meetings? I mean, are you conscious of that when you go out most of the time?
I honestly say no. I mean, I'm always aware of my surroundings, whether it's in my official duties or just in a general sense of my family and I are traveling in the city. You need to be, kind of street smart when you're out there in the community, regardless of your public official or not.
I tell you, one of the things that I think, I thought the president gave a great speech last week, and we don't need to talk about that. We have some other things I want to talk to you about, but I thought he hit the right tenor. He didn't blame anyone. Talked about how we deal with each other and the level of rhetoric. And again, we got to protect the First Amendment. I mean, if people want to say, I had an old professor who said that the Constitution guarantees the right of us to make complete fools of ourselves.
Yeah.
But on the other hand, don't you think there ought to be, now I've followed your career, you always speak the way you are now. You don't use inflammatory language, you don't demean. Can't we, you think that will help you and your colleagues on both sides of the aisle to elevate the rhetoric a bit?
Well, the tragedy of January 8th will serve as a wake-up call or a reminder that we need to be civil. We can be passionate about our beliefs and expression, but the way I look at it is we need to always be mannerly. And so when I carry myself as if my mom and dad were standing there watching how I conducted myself, would they see me as being responsible and with good manners? So we don't want to in any way say to the citizens, you shouldn't come out and be passionate. We want you to be passionate in expressing your views.
But having said that, we use language, we use sports metaphors and martial metaphors, like the Republicans have targeted 10 seats, the Democrats have targeted, or we use all kinds of sports metaphors that involve bumps and hits and in and of itself, that isn't that wrong, is it?
I think when it's taken in the context of a campaign, or you need to understand that's part of the dialogue.
We have about a minute left. Congressman King from New York thinks that you ought to support a bill. You all ought to pass a bill. No one is allowed to have a weapon within 1,000 feet, I think, of you folks. Yes, is it a good idea or bad idea?
Bad idea. Again, we don't want to allow the wrongful and outrageous attack of one individual to then let us become a security state. And the Second Amendment, the right to bear arms is important. And again, that type of law, and I think the world of Peter, a great colleague, if we had that law, that would not have changed the events of January 8th.
Look, I want to thank you for coming on, and keep up the good work, and you're welcome on this program anytime.
Appreciate the opportunity. Look forward to being back with you.
All right, thanks. See you next week for another edition of Pennsylvania Newsmakers, and as always, you stay well.